From the 28th to the 30th of September 2017, the International Conference Risky Crossroad Diabetes, Coronary Artery Disease and Heart Failure took place in the Old Royal Palace of Belgrade, Serbia. Professor Seferovic, chairman of the symposium, highlighted that this meeting has been dedicated to an update on diabetes, coronary artery disease, and heart failure and their tight relationships.
Our message to the public, our message to the colleagues should be they need to be extremely careful in terms of paying a lot of attention on the patient with this disorder and diabetes, because they may have the ominous sign which are probably not recognized very early and may be very dangerous in the later stage of the disease, presenting with sudden cardiac death or acute myocardial infarction, or in some points as a stroke.
The main topics discussed in this symposium were about the pathophysiology, molecular and translational findings, dysglycemia, risk evaluation and prevention, clinical aspects, diagnosis and treatment. The Congress has been attended by many of the top researchers of this field coming from all over the world, and by many cardiologists and physicians working on these topics. Professor Cosentino talked about the so-called bad legacy effect of hyperglycemia responsible for the pathological circle activation between ROS and PKAC, and the role played by P66. The speaker presented very interesting experimental data demonstrating that type 2 DM is associated with an epigenetic remodeling in P66SHC, pointing to the role played by the glucose fluctuations in driving many epigenetic changes. Professor Heiner talked about the pleiotropic effects of insulin beyond the glucose control and presented very interesting data on the effects due to insulin resistance in cardiovascular disease patients and on its pleiotropic actions. In the second part of his lecture, the speaker talked about the relationship between the impaired energy metabolism, poor muscle function, and insulin resistance. More in particular, Professor Diner presented very interesting data on the role played by the metabolic impairment and inflammatory activation in the pathophysiology of heart failure and diabetes. In conclusion, the speaker pointed out that hypoglycemia and insulin resistance are causal, but the second one is very intrinsic to heart failure pathophysiology. Professor Sando spoke about the impact of diabetes on the outcomes of patients affected by heart failure and highlighted that the risk of heart failure increased a lot in new diabetic patients. In the main part of his lecture, Professor Standel presented a huge amount of data given from the main clinical trials running in diabetic patients affected by cardiovascular disease. More in particular, the speaker discussed the most important data on this topic published from the UKPD's The Sweetheart, the EuroHeart Survey Diabetes Studies, and finally talked about the main diagnostic criteria for dysglycemia and about the main glycemic parameters informing a diagnosis of uncommon diabetes in coronary and artery disease. For deeper knowledge on these topics, please visit the International Menarini Foundation website, where you can find all the speeches in their full version.